The World Health Organization recommends the doctor-to-patient ratio at 1 to 1,000, but the number is much higher, one doctor for every about 25,000 people. One of the reasons for this state of affairs is that many practitioners seek greener pastures abroad, which comes with better pay and amenities. In August, President Yoweri Museveni directed that the salaries of medical interns who earn 750,000 shillings would be raised to 2.5 million shillings. The increment would be across the board.
About 3 months ago, on 6th of August, and at that time we served the government with a 90-day notice of industrial action, and that this 90-day notification period will expire on the 6th of November.
The Permanent Secretary of the Ministry of Health, Dr Diana Atwine, said government is committed to increasing salaries of medical workers, and the process towards this is about complete.
Striking at this time would not be a good gesture when actually everyone is advocating, everyone is really pushing to make sure that our health workers are paid well. It would betray the trust that our president has put in us, our cabinet has put in us, our members of parliament has put in us, and most importantly, the public that we serve.
Atwine explained that by the time the president issued a directive, budgeting for the financial year 2020-2021 had already been passed, and supplementary funding was sought for its implementation.
The request has been submitted to Parliament, and I do believe that our honourable members of Parliament will sit and pass that supplementary, and once that is done and the money is available, we will be able to pay them.
Besides salaries, the medical workers have complained about their welfare that includes lacking personal protective equipment as they deal with the COVID-19 pandemic.
The consumables that you just consume, like tissue, you of course at one time they will get used, and you need to replenishing, and that means you have to continue putting budget there to buy more, and which has been a big challenge for us, because with these PPEs are very expensive.
The quicker Parliament will pass the supplementary budget submitted by the Minister of Health to enhance the salaries of the medical workers, the sooner they will smile all the way to the banks. However, all this will also depend on the availability of resources from the Ministry of Finance that is already overstretched. And critics are saying that some of the long bureaucracies that are quite tiring are some of the issues that impede progress in government. Sudhir Yaruhanga, NTV.